some thoughts about how she views grief in childhood and how she helps children and families who are grieving. I might say a few words about what a pediatrician does to help parents as well and children. And we certainly want this to be an interactive process so that if along the way, if you have questions, please feel free to, I'll monitor the chat. Feel free to put them in the chat. If you would rather ask them verbally, just let me know and we can do that as well. So why don't I get started? And it's my huge pleasure to introduce Shelly Bathe Lenn. She has a master's of education as well as a certificate of advanced graduate study in school counseling. She is the bereavement coordinator at Cooley Dickinson VNA and Hospice, as well as the bereavement specialist for Massachusetts for unexpected infant and child death at Boston Medical Center. I've known Shelly for over 20 years. It's been a long relationship of trying to help children and families going through the grief of a loss. She is the lead person and has been for over 20 years at The Garden, which is a center for grieving children and teens, which meets in Northampton. She trains the people who attend those meetings and who help parents and children who are grieving. And she runs that group, as I said, for over 20 years. In addition, she travels around the state helping school districts who have experienced the loss of a student and helping teachers and students grieve, as well as educating clinicians and physicians and pediatricians like myself who are seeing parents and children who are grieving. So thank you so much, Shelly, for joining us, and I look forward to hearing your thoughts.
Thank you, Dr. Schwab, and thank you to everybody who's on the call today and who will be watching in the future. It's a real pleasure to come and talk about grieving children, grieving teens, and their families. So I'm going to, I'd love to, for anybody who would like to, I'd love to get a sense of those who are on the call today. What is it that is what brought you here today? Is there something specific that you'd like to learn? And maybe between Dr. Schwab and I, we can, definitely target that. If you want to say it out loud or put it in the chat, that would be really interesting for us. But if not, I have a presentation that I'd like to share about how to support a grieving child, a grieving teen, whether that be, you as their caregiver or maybe someone close in their life, as an auntie or even a teacher or a neighbor. So hopefully there'll be a little bit of something for everybody. I'm going to move to sharing my screen, if that's okay.
Mm-hmm.
Oh, wait a minute. For some reason, the news came up on my screen. Whoa, hold on. This hasn't happened before. Okay, there we go. Got rid of that. Sorry about that. And go to this, go to this, and go to this. All right. Can you all see that?
Yes.
Super. So just a tidbit about the garden. We just celebrated our 25th year last year, and our goal is to support grieving kids. We do have an age limit in terms of how families who come to the garden. So between the ages of 5 and 18. However, I've worked with plenty of families who've had children younger than 5, and even those that are beyond 18 and in high school and college and beyond. So even though 5 to 18 is the word on the street, so to speak, it doesn't limit the amount of help that I can give to a certain age. So we are a program of Cooley Dickinson VNA Hospice, and we're here to provide support that is not therapy. We're not here to diagnose or treat or prescribe. We offer trauma-informed support for children and their families. And this program is offered at no cost to any family, school district, or office, just so you know. Sorry, now I can't advance the slides. Here we go. Um, so our primary support is our family support program. We meet with children and their families on Sunday afternoons. We have a fall program and a spring program. We, for over 10 years, we've been working at area schools, as Dr. Schwab had said. We can partner with a school to come in on a weekly basis and lead support groups with kids who are grieving. We also have a grief literacy program where we can come in and to a classroom and start a gentle conversation about grief, death, and dying using books. And then I'm also available for consultation and trainings, whether that be an individual family level or organizational level. There's my good phone number for me and an email. And we are on Facebook. We've been on there for quite a while. So you can go to Facebook, and I try to post things on there that could serve as a resource for an individual, their family, a child, or an organization. So I invite you to go in there and dig around and find some things. We've put book reviews, activities, links to different organizations nationwide. Just check it out. So I wanted to talk about what we know. The elephant in the room is that all living things die. Of course, we don't know how, we don't know when, and or where for that matter. But in fact, they do die. Cells break down and eventually stop working. And in Massachusetts, in 2022, we know that 1 in 14 kids between 1 in 14 age 18 and younger will experience the death of a parent or a sibling. And this comes from an incredible resource out of the Judy's House, which is in Denver, Colorado, called the Childhood Bereavement Estimation Model. And they do this if not every year, every other year, for every state. And I just find it an incredible resource to get specific information about numbers and specific to, as I said, a parent dying or a sibling dying. So with a change comes grief. Any change. Let's talk about those changes. There is a question in the chat.
I can.
Okay, got it. Yes, thanks. You go for that. So grief is a normal and natural response to any change. It is always changing. And I think that's what makes it so hard for individuals, because we don't know what's around the corner. From moment to moment, whether it's a memory that comes up watching something on the television or driving down the street. And also important to know is that it's unique to each individual, because each person has had a different relationship with the person who died. And so their grief is going to look a little bit differently. Robert Niemeyer is a great researcher in this field, and he states that grief evolves as we do. It can be messy, and it contains thoughts, feelings, and behaviors. We're going to look at that in a little bit. So thinking about changes in general, of course, the garden focuses on a human has died, but we grieve any change, whether it's relationships, home, losing things, losing an ability, changes in health, even changing seasons. There can be a grief response to any of these. So it's important to recognize that. And another thing about grief is that we're not doing things wrong. It's just a response to that change. So grief isn't anything to fix. It's something to experience and to support. There are phases of grief. There's the acute phase where, it just happened. There can be lots of turmoil, emotional turmoil, intrusive thoughts. Um, then one moves into kind of a transformational period where there's some adaptation to the loss, a shifting of, okay, now this is what I do. This person doesn't take me to school anymore. This person does instead, or I take the bus. The intensity tends to subside with time. And in my experience of working with grieving kids, I see this, and grieving adults for that matter. I tend to see this, 3, 6 months, around that time period. The reality of it tends to, um, have sunk in. And so people, they they begin to understand it a little bit more, and do not see, such intensity anymore. That doesn't mean that they don't feel the loss anymore or they don't grieve anymore. It's just transformed. And then within a few years, um, then we're moving to a phase called integration, where we've kind of accepted the reality. We can love again. And so for children where there was a parent or a parental figure who died, within some time, depending on the support that was given them, the also depending on the way in which they were allowed to grieve, they can then begin to think differently about the person who died and maybe begin to love again if, their parent or guardian chooses, a path of a new relationship. If there are questions about any of these slides, please just jump in.
I'll
So,
monitor that. And there was a question which I think we can get to at the end about resources and other
oh,
options.
okay. Okay, great. Absolutely. So those are the phases of grief. And I caution you to thinking about the stages of grief. That is something that is kind of common to see in our culture. But Elizabeth Kubler-Ross is the person that we have to thank for thinking about death and dying and grief. And she originally came up with the stages of dying. And over time, those have been co-opted to the stages of grief. And those are very different experiences. So I caution you to thinking that there are stages and that once we get through them, we're done. Because that's not how grief works. As I said, it is unique, it is different to every person, and it actually doesn't go away. The intensity goes away, it shifts, but there will be times in one's life where the intensity is up again. And so I just want to make sure that people aren't hearing me and saying that first there's this and then there's that, especially when I was thinking about the phases of grief. So next, I just wanted to mention the different types of grief. So as this slide shows, we've got anticipatory, ambiguous, complicated, disenfranchised, and normal. So anticipatory is the lead up to one gets a diagnosis and the family has to kind of learn to cope and learn to deal with, the prognosis, which of course, in our field is fatal and will lead to actual death. Um, Ambiguous loss, loss without closure, what happened, not having a lot of information around it, maybe not even knowing that the person was going to die. That can lead to ambiguous loss. Complicated. So, complicated grief, I should say, is something that does end up in, can lead to some really severe issues, complicated experiences. And this can come from when someone didn't have all the information, when they weren't allowed to grieve. So sort of a combination of the ambiguous can feed into this as well. And those are the two big ones. They, kind of didn't have a chance to grieve, didn't know what was happening. And so had to kind of bury those feelings. And that whatever they were thinking about it just had to be put away. So if someone is you watching someone and they're having intense emotions for 6 months or longer, it's hard for them to go to school, or they refuse to talk about the person who died, or there's stark changes in their behavior in terms of maybe sleep or diet or a friendship group. Then we might want to put them in the category of complicated grief. Um, it's not something that uh, it's a life sentence, so to speak. It's just that things are taking a lot longer for them to kind of accept and work through. And then there's disenfranchised grief, when one is denied the right to grieve, whether that's around a stigmatized death, or maybe there's, a relationship that people didn't really accept. That's the disenfranchised grief. And then normal grief, a reaction to loss, it's ongoing, and lo and behold, it's evolving. With children, what we know is that as they cognitively mature and understand what that death means in their life, they can go through a re-grieving process. So what a child might understand at age 5 versus 7 or 10 is very different. And so there can be times where that, 2 years later or 5 years later, they might have an experience where they're really feeling that loss heavily again, and or maybe for the first time. And that's because, as I said, they've matured, they understand it now a little bit differently. And so some feelings, different feelings are coming up, or new feelings are coming up. One's whole body feels grief. I like to say it slices and dices us all over. There's an affective response, a cognitive response, behavioral, and somatic. And when I get to the somatic, maybe Dr. Schwab wants to say a little bit about that. But an affective response are all the different feelings that one may feel after this death. They may feel angry that their dad isn't here anymore, or we may find them feeling, maybe an offshoot of anger might be irritable or frustrated or just moody. And that may be kind of just going back to feeling mad that this happened to them. What I want to say about feelings is that any feeling we have, actually, whether we're grieving or not, is okay. It's what you do with those feelings that counts. So it's actually a-okay to feel mad, irritable, maybe even numb or relief. But it's what we do with those emotions that counts. Do we feel them in a way or express them in a way that hurts us, hurts others around us, or hurts the space that we're in? And that's what we want to avoid. So our goal at the garden, and we'll get to this, is to help kids, first of all, understand what their feelings are, and then give them opportunities to express those feelings, or learn how to express those feelings in ways that are pro-social, positive, that don't hurt themselves or others or the space that they're in. we have, when we're grieving, we have a cognitive response, and some common cognitive responses are there. Um, we begin to worry, or it can be really hard to concentrate. And this one's really important, thinking about school, returning to school. A young person has, maybe over the weekend or over the break, there was a death, and they may want to go back to school. But when they're there, it's really hard to concentrate. And so I'm very often having conversations with schools about how they can support that student with accommodations. Give them a little bit extra time to take that test or finish that paper, or answer that question. It's not that they don't want to be answering the question or focused on whatever. They're just thinking about what happened, and they're replaying it over and over in their mind. And so that's a cognitive response. And of course, that can have, depending on the classroom and depending on the school and the teacher, that can be, a real hard thing for the teacher to watch. And so I like to come in and explain that to schools, and again, support them in giving kids accommodations. Not forever, not for the remainder of the year necessarily, but for a certain period of time. Next is our behavioral response. Some real common behavioral, the number one actually of people of all ages is sleep, nighttime disturbances. I cannot tell you how, whether the person is 70 years old or 7 years old. When one is grieving, it seems like this domain of sleep is just gets rocked. Either it's harder to stay asleep or harder to get to sleep. And I think it's because at bedtime, the day is a little bit quieter. There's no more, playing outside. There's no more, thinking about homework. And so that child's mind, that child's thoughts goes to this person who has died, and all the woulda, shoulda, couldas, worries, or maybe there's some guilt, and anything at all that they've been kind of thinking about during the day comes up big and much louder at the nighttime. And so that's the thing that can attribute to a child having a harder time sleeping. When that happens, I'm often helping parents, supporting parents think about some strategies to help that child sleep better. And I know this is a topic that Dr. Schwab also supports as well. But some of the strategies that I give to families are around the importance of sleep hygiene, and kind of starting early in winding down, maybe putting the screens off, making sure that there's kind of a ritual, a bedtime ritual, so to speak, of, first we bathe, then we brush our teeth, then maybe some time with books, and maybe a little bit of snuggle time, and then go to sleep. And so once that child or that student kind of realizes that, oh yes, there's a routine here, and it's actually their brain that's picking up on that routine, it knows that, okay, now we're going to sleep. But that said, night lights can be really helpful then. Maybe some, soft music. But there's also children, especially in the acute phases of grief, where they want to sleep with their adult caregiver. They're scared at night. And so being able to spend extra time maybe in the adult caregiver's bed can help them feel a little bit safer. And or maybe if the bed isn't an opportunity or something that would work for your family, I often talk about building a nest in the adult's room, maybe next to the bed. Or having a schedule where they can, nope, on Friday nights you can sleep in my bed, but or Saturday nights. So supporting children around sleep, supporting families around sleep is a real big thing, because it's one's behavioral response. And then there's the somatic response, which is how we actually feel in our body. I have heard countless children talking about, how hard it's to go to school because their stomach hurts, or they're really tired, or they have headaches, and that's their bodies, their physiological response to this grief and the news, the information that their person has died. All of these responses aren't necessarily going to lead to a new person. They're not always going to be hard to sleep or have chest pains or digestive problems. This is their response right now. So I want to give you a little bit of hope around that. But I like families to know that there's a whole body response to help them kind of have a bigger picture of what could be going on. Let's see. Okay, so just a little bit of research, talking about, just grief, and that it is a real thing for children, a primary emotion, says these folks from 2021, and the Mayo Clinic reminds us that grief is a strong and sometimes overwhelming emotion. That's why we're here. So lots of people think that children don't grieve because they don't understand it. But in fact, they do grieve. It will look different, sound different than when an adult grieves. And I like to say that we have to catch them in their grief. Since the work of children is play, that's more likely where we're going to see it, in how they're playing with their toys, or how they're writing their stories if they're a writer. And if we listen close enough, we might see them acting out maybe an ambulance scene or a hospital scene. And so that's their way of processing what happened, is through play. It's a-okay. It is not, they're not doing it wrong, because grief isn't doing anything wrong. It just means that's how they're processing what happened, and acting it out in play is okay. It's actually important for them because they're expressing what they saw, what they thought they saw through their play. And that doesn't hurt them, doesn't hurt anybody around them, and it doesn't hurt the environment. So that's really a great way for a child to play, especially when they're grieving. All right, so now we're going to talk about what children grieve. We know, what children need, grieving children need. So we know, of course, they need love, sustenance, and shelter. Absolutely. We're not going to at all dismiss any of that. The number one need for children is safety. And it's actually for all humans, but we're going to focus on kids. After someone has died, I often hear just incredible stories about a child wondering, or a teenager worried about who's going to die next. Because of course, a child's day-to-day does not often, except when they're grieving, they don't wake up thinking, oh yeah, what's this about death? And oh, I might die, or you might die, right? It's just not, it's just not a part of it. But after someone has died, they can begin to wonder, think, and even worry, or have questions. Are you going to die? Is she going to die? Like that. It can be really scary to hear those questions and to kind of witness your child or a child having those worries. But it's actually okay. And it's important to listen to them, not to deny that question, but to listen to them. So a child needs safety, and I want to talk about how there's two distinct domains where children can feel safe: in their routine, and even traditions, as well as their health and well-being. So safety is really hard. It's not something that you can pick up at a store or you can get at your doctor's office. It's intangible, right? And it changes whether we're inside or outside, daytime, nighttime, with people we're familiar with or not. And so that's what's tricky about safety. And so let's talk a little bit about um, some things that can help a child or an individual feel safe. So structure and rituals, traditions are really fun, especially family traditions, but they also work to help a child feel safe. The structure of a child's day, as I was saying before about sleep hygiene, that structure can help ground a child, can help them feel safe and know what to expect from day to day or hour to hour. So the school day offers a ton of structure for kids, right? And oftentimes have had questions where, wait a minute, my child wanted to go back to school and it's only been 2 days or a day. And I push the pause button on the family's concern. And I share with them about how that child most likely feels pretty safe at school. They know where to sit. They know what comes before lunch or after lunch. They know their teacher. They know what to expect. Whereas at home, especially in the acute phases of grief, um, everything is up for grabs. It's a total surprise. People are coming in and out. An adult caregiver may be spending all their time in their room because of what happened. And it's just hard. It's difficult. It's constantly changing. So school can be a safe space for kids. However, once they go to school, as I mentioned before, that school day, that student might not be all there. They may be zoned out looking outdoors or having a hard time just sitting still. But yet they do feel safe there. And then there's all the amazing family traditions across cultures and families that help us feel grounded and connected and safe. The other domain that I think can help kids feel safe is in their health and well-being. So children who are grieving don't necessarily think about their health and well-being as a sense of safety, but it's where we can remind them of how they are safe. And so and how they're going to be okay. So thinking about, making sure that they're eating and that they have, as healthy a plate as possible. Making sure they're still getting to their regular doctor's appointments and getting outside and playing. But then also thinking about wearing seatbelts in the car. We have to do that because it's a law, but in fact, it keeps us safe. And when a child is grieving and the adult might feel like they're extra clingy or because they never leave their side or they're worried about what's going to happen next, we can start to remind them that they are indeed safe. So when a family gets into a car, maybe for a certain period of time, shine a spotlight on what you are doing for your child, for your family to keep them safe. So you can look back and say, oh, everybody's got their seatbelt on. We're all safe. Or I've got my seatbelt on. I heard it click. I'm safe in my car. But then, of course, following traffic laws, wearing helmets on bikes and skis, or looking both ways when we cross the street. All of those that we do kind of day in and day out and don't even think about, if we were to shine a light on that for our children after a death, that can kind of they can internalize that and begin to feel safe in their home with their family. All right. here's another study I like to weave in, things that I've read or things that I've found about grief and helping people understand that having a safe and non-judgmental place to express emotions is really important. Um, and, one way that this might look in your home is maybe you're not feeling a sense of fear or not safe, but that doesn't mean that your child doesn't. And so, making sure that the door is always open for your child to be able to express those feelings and to be open to hearing them talk about things that might be hard for you to hear and or might be different than how you're feeling. That's okay. So my favorite way to tell families about how to keep that door open, the metaphorical door, so to speak, is open-ended questions. Our job as parents is to, our hard, most difficult job as parents is to get inside the brains of our kids and try to help them or try to understand what they're thinking, right? And it's those open-ended questions that provide an invitation to talk, even about hard things. And so that's where we want to get is to a spot where the child feels like they can say anything without being judged. Okay. So, but ultimately, our child, I mean, this is our child feeling not safe is because their world has been turned upside down. This person has died, the significant person in their life that they saw, lived with every day, or saw on a regular basis. And so, as much as we can help them feel safe with wearing seatbelts and talking about the diet that we provide and doctor's appointments, in the end, the conversation that I feel like ultimately needs to get to telling the truth. And by saying all living things die, most people live to be very, very, very old. And the most precocious of kids, especially a 7-year-old whose mother just died at the age of 42. Well, mommy wasn't very old. Her mother is still alive. And how did that happen? So that's why I say all living things die. And most people live to be very, very, very old. Most is the operative word in there. And this is what I'm doing to keep you safe, going back to diet and exercise and doctor's appointments. But the key there is to prove it. You can't just say these words to kids. They're watching our every move. And they want to know that you really are doing what you can to be here for them for as long as you can. So they're going to make sure that and maybe they might not be able to articulate it to us, but they're going to be looking out a little bit more cautiously, like, oh, wait a minute. Is mommy, going to her doctor's appointments? What does the plate on her food look like? Or is he wearing his seatbelt? They, are becoming a little investigators because they want to trust you. And so they want to know that you're telling the truth. So the prove it is there. But then in the end, our child wants to know that what's going to happen if something does happen again. So if one parent has died and there's a two-parent family, they're worried about that last parent. How do we know? And as I said, all living things die. And so ultimately, what would be give a child the most hope and the most trust is to know that there's a plan in place if something were to happen to the other caregiver in that household. The plan is not something that we can come up with on dime. It is something that I encourage families to spend some time thinking about. It's really a difficult thing to think about, right? And so there needs to be some time with people you trust, whether it's a counselor or someone in a house of worship or a close friend or even a lawyer. but spending some time thinking about what will the plan be for that child or those children should another caregiver die. We can't make any promises to children because we know that all living things die. So to spend some time thinking about what the plan will be. A child can be very worried about this, even though they don't articulate it. It's okay that they're worried about it. The ego reigns large with children. It is developmentally appropriate. So don't think that your child is doing it wrong. And certainly doesn't need to be punished for it. They just have worries. They thought that, there would be more caregivers in their life because they were there the week before, right? So that's something that at the garden we can talk more about. I'm available to help families come up with a plan, think about a plan, and how to, what to say and how to approach it with your child. But to keep that in mind, that when it comes down to it, that's what the child is most worried about, is themselves if something were to happen again to someone else close in their life. All right. So at the garden, safety comes through ritual and commitment. The commitment is we ask families to commit to our Sunday schedule. It's 8 weeks. It's on Sunday afternoons from 2 to 4. We commit to setting up each of our spaces and having our activities and materials planned in advance. And then there's ritual. We start out each and every Sunday lighting a candle and saying our names and who we're here to remember. And that's our opening. And then at the end of our day, we sing our song, Lean on Me. It's those opening and closing rituals that goes back to what I had said before that helps people feel that at the garden, this is a safe space. All right. So we know that grieving youth need to feel safe. They also need to know what happens. By golly, the truth trumps. So let's talk a little bit about euphemisms versus the D word. And in this case, the D word is dead or die or dying or death. Euphemisms are all over in songs, in movies, in books. Here's just a small list of them. I know they come from a place of love and not wanting to scare anybody, but when it comes to children, when we use them, it can be very confusing. As opposed to when we are comfortable using the D word. How many dead end street signs have you seen? Or I am dead tired, or he's a dead ringer, or she's such a deadbeat. It's just incredible the ways in which we will use it, which isn't true, but when we won't use it because it's hard to hear. So I invite you to think about using the D word in all its different forms to help children explain, to help children understand that a person has died. So not only that they've died, who they are, but what happened? Where did they die? When did they die? And how did they die? For some children, those answers to the questions will be a little bit more complicated. And so at the very least, it's important that children understand what happened on a physiological level. Their body stopped working and their body has died. And in our family, we believe XYZ. And then we want to follow the child's lead. Well, how did they die? And then you can talk about cancer or the car accident or what happened. We don't want to make up anything for children. We want to be truthful with them. If we don't have an answer, then you can say that with your child. When they see an adult not knowing an answer, that teaches them that adults don't know everything, and that's okay because we can find out. We can work together to find the answer. I love to use books with grieving children. Really, really powerful. And these two are my favorite. In fact, I just went into a 3rd grade classroom last week and read The Dead Bird by Margaret Wise Brown. And look at that. That's not a mistake at the bottom. She wrote that book over 80 years ago. This was the second edition, but it's just a sweet book. And she just nails it. She talks about what it means when something dies. She talks about how it can make us feel. I think the line goes, and the children were sorry that the bird could never fly again. And then she goes into commemoration. So it's all right there in that book, not even 20 pages. And it's a great book to use. And the 10th good thing about Barney on the very first page. Um, my cat Barney died today. I was really sad. I couldn't eat my dessert. So Judith Viors puts it right out there all those years ago. Powerful tools to use with young children. Some other favorites. I Miss You by Pat Thomas, a little bit more recent. And these guys, oh my gosh, When Dinosaurs Die, A Guide to Understanding Death. It's my one-stop shopping when it comes to talking to children about death. These are the folks who did the Arthur series on television, the strange little characters. But in this book, a family can talk about what it means to be alive, what it means to die, and all the different ways, whether it's at birth, in a car accident, even suicide, or an act of war, how we can remember them. There's so much in that book. It's just an incredible tool. All right, just a few things about the cognitive variations and how amongst the ages of children. So our youngest children, that's when we see the extra clinginess. They will have, they can pick up on kind of the tone and the feel in the room around them. They might not know and be able to say it, but they can sense that something has changed and absolutely will miss a familiar person. Coming up to kindergarten, first, second, third graders, they're having concerns about, there we go, safety. And they may have some strong expectations that it's going to come back. That person's going to come back. And so we need to work with that child to understand that death is final, that it's universal, and that it's nothing that that child can change or do anything about. Upper elementary, begin to understand that it's final, that it's irreversible, and can become really curious about kind of the biological aspects of life or death in this case. So it doesn't mean that they don't care. It doesn't mean that they're not grieving. They are curious. And so having the patience to help them understand how cancer works or how how the heart might stop beating in a car accident, for example, is kind of where they are. And don't get me wrong, there could be some 5-year-olds who are also very curious about biological aspects of death. So this is just a general guide and is not, hard and fast about your child. And then we've got the adolescent age group. Most of them will have a good understanding that death is final and universal, but they may be feeling pretty vulnerable and overwhelmed. And it's really important for families with kids in this age group to know that they are still kids. Their brain has not fully developed. And so, times of extra cuddles would be really appropriate, even though, your child is 17 or 18 years old, because they're sad, they're working through this. Okay, so there was an amazing study done after the tsunami in 2004. A lot of the people who died in that tsunami were from Northern Europe. And this study followed some of those families and found that when they were able to go back to where the death happened, they had a sense and more of a sense of what happened and kind of closure because they could see with their mind's eye, with their eyes and really truly understand a little bit more. So they could fill in the blank, so to speak. So these are adults. And so I bring this out because it's even more important for kids. And that's why I think when we are telling them what happened, we want to give them as much information as we have, and not to keep that from a child. This was a study that looked at 130 Norwegian adults, and 113 of the adults out of that 130, getting to the 92% in the slide here, were able to go back and visit the site. Pretty incredible study. So, as important as I think it's for kids to hear the truth, I want to acknowledge absolutely that it's not always easy to say or hear. Absolutely. So, starting with the basics. When a human dies, the body stops working. The heart doesn't pump blood, the lungs don't fill up with air, they can't move, they can't talk. His body stopped working. They died. We are so sad, and we all wish that she or he hadn't died. There's a script for you to use. Now there are the stigmatized deaths from a substance use disorder or even suicide. And here's some language that you can use, helping a child understand that a substance use disorder is an invisible disease that causes a person to use more, take your pick, than is safe, and that can cause someone to die. And something very simple, they died from taking too many drugs. I often hear, medicine being used, and drugs is on the fence as well. You need to make a distinction between the medicine that we get prescribed when we have, an ear infection, so to speak, as opposed to the medicine that they took, and their body died. First, they took too much of it. They did not follow the doctor's orders, and it made their body stop working. And next, about suicide death. First, let's all join in and stop saying committed suicide. Instead, let's use died by suicide or they had a suicide death. Committed suicide, and I have family that I was just talking to about this. Committed is actually something that we associate with something that shouldn't have happened. So someone committed a crime. It is against the law. They could be brought to court. Suicide is not a crime. So let's take committed out of the language, out of the, out of our minds, and try to switch over to died by suicide or they had a suicide death. Now, here is a couple of scripts to talk about and to help explain death by suicide. I think it's great if we can incorporate, a language or a feeling state, and to remind the child that, you are all right and that they will be all right, but your cousin or the person died last night. And then to go further, we've heard of a heart attack. Well, this is sort of a brain attack. Their brain was not working properly, and they chose to make their body stop working. So the choice piece is another important word as well. Okay, so at the garden, we obviously use the D word, but we will also have activities around helping kids understand. We will read those books in our groups. We will have a discussion. What is death? To try to gauge where the kids are with it. And we also make time for sharing stories about who died, so that they know that, first of all, they're not alone. Everybody at the garden is remembering someone who died, and these are their stories. So we know that kids need to feel safe. They need to know what happened. They also need to be able to feel their feelings. Grief, in fact, is experiencing the feelings associated with a death or other loss. And again, there's no right or wrong way to feel. It is what is done within that counts. And when we don't express feelings, when there's unacknowledged pain, Megan Devine wrote in her book from 2017, it can lead to substance addiction or anxiety or depression. And so at the garden, we want to make sure that that doesn't happen. And so we want to give kids a safe space to feel those feelings. And here's a whole range of feelings on the screen that you may be seeing or hearing or feeling yourself or watching those in your care experience. So with feelings, we can really do a lot at the garden. Our activities, our projects, our games. For example, we may go outside and play feelings tag. We have these great little tools called thumb balls, and I'm holding one in my hand right now, and there's all kinds of feelings on it: embarrassed, hurt, generous, thoughtful, shy, sorry, lonely. We bring these games and these projects, these activities to help kids learn about different feeling states. We had a discussion once with high school kids, and we did one of these, I think it's a word cloud, and we had them talk about their grief, and these are their words. And the words that came up more often, remembering, whoops, sad and hurt, they're larger on the screen because they came up more and more. Some other activities that we've done at the garden and continue to do. There's a great book called My Many Colored Days by Dr. Seuss. Has nothing to do with grief or death, but I love to use it with kids because it begins to help them develop a feelings vocabulary. And that's a page from it on the left. And then on the right, she's holding up a Play-Doh sculpture where we will invite kids to take a draw a feeling that I've written on paper in a hat. They'll draw it, and then they're invited to sculpt it. And then it becomes a conversation around the table. Who's felt that way? How did you feel? What did you do? There's the feelings tag, and these are some other activities that we like to do to help kids understand grief and to feel their feelings. All right. And then my favorite part of the garden and working with families is commemoration. It's important that we have the opportunity to express emotions and remember the person who died. So commemoration is exactly that: remembering the person who died, speaking their name, looking at their picture, sharing memories, playing their favorite music. And you could go on and on. Even just speaking their name, it's very easy, it's very quick, but that's commemoration. That's commemoration in a very simple form. And here's a lot of people talking about the importance of commemoration, whether it's at the memorial service or around the dinner table or at special times of the year. Rituals may not only reduce negative emotions, but also increase positive emotions and help a child or a young person feel like they're part of, feel connected to friends and family. It's really important that children are invited to participate, to attend and help plan. Yes, help plan the memorial or the funeral or the wake. It might be a shock to some, but when they have a chance to participate and help plan, they learn and they internalize that they are a part of this family, and they also learn how to commemorate. It's important, though, to explain the rituals before the child is attending the funeral, for example, what's going to happen, what they can expect. I also think it's important for that child to have a point person that's not the primary griever. If it was a parent who died, maybe there's a cousin or a friend or a close other person that can hang out with that child, so that the partner of the person who died doesn't have to worry about the child or the children. And here are some ways to commemorate. Their music. I often talk about have a dance party with their favorite music and the whole family gets to dance or hear the music. Light a candle, carry their picture, get a tattoo, write them a letter, plant a garden, talk to them, snuggle in their shirt. There's all kinds of ways. You do not have to break the bank with this. It can be very simple and, you know, and continue it well beyond the funeral. A personal example here. So this is the 30th anniversary of my father's death. He and I were both raised in Texas, and I just returned from a trip. I took my son, who never met my father, and we traveled down to Texas and we visited his grave. My son has grown up getting to know his grandfather. And so it's really important for me to involve my son in going down to see my dad's grave. So that's something that, you could do too. Some other ways to commemorate, maybe you work at a school and you know someone, a child who has died, and ask them this question. I never met them. Tell me about them. Were they tall? Did they have glasses like you? Or did they like soccer like you? Engage in the child, asking them questions. Another activity or question, if you could say goodbye today, what would you say or do? I want to there's some other questions on there as well. Open-ended questions are my favorite, right? It kind of opens the door to a bigger conversation. And I want to acknowledge that sometimes relationships between a child and a caregiver, a child and a parent, was not a close one. And so how do we support commemoration when they weren't close, or it was very fractured, or maybe they didn't have an ongoing role in the life of that child? That person's life is still worth remembering, and in small ways, whether it's a picture in a quiet spot of your house, or just saying their name. And engaging with your child about that is absolutely important. Um, you know, not necessarily with the goal of explaining why it was a difficult relationship, but to get your child to understand that you're a safe person to talk about how we have different relationships with different people. But in the end, it is really important that everybody has the chance to be remembered. And so at the garden, I mentioned our opening circle. I did not mention our memory meal. This is an amazing tradition that we do every fall in December, where we invite families to bring in a dish to share that was significant to the person who died. Whether it's a dish that they like to make or like to eat. And it's something that can be done at home, on a monthly basis, or, maybe weekly, especially at the beginning and the acute phases of grief, or in the transitional phases. You know what? I remember she really loved making apple pie. Let's make an apple pie together. Something like that. It's helping your child learn that they can remember the person who died. And it's also teaching them some things about their person that they might not have remembered or knew. But commemorative activities are really important things to do. These are some things that we did with families. This hand activity, they each traced their own hand, and then someone made a heart to put on top of their hands. All right, so now we're at the end. A reminder that grieving youth need safety, understanding, to feel their feelings, and commemoration. I hope that there were some takeaways for each of you, something new that you learned. Here's some resources. These are online resources. I tried to put lots of different approaches to it. What's your grief at the bottom? is an incredible resource. They've got a great list of 64 books for grieving kids. Learn to Cope. That's a group for those families where there is a substance use disorder. And here are some books. A Parent's Guide to Raising Grieving Children by Phyllis Silverman is amazing. It's riddled with anecdotes of how children, it covers everything from how they understand, how they can process, how they can feel their feelings, and guiding your child through grief, a little bit older, but some really uh, awesome resources there. And then these are my resources that I used for today's talk.
Thank you very much, Shelley. I really appreciate you reviewing all that detailed information about how we can help kids who are grieving. Let me go back to one of the questions that was asked. Somebody asked about about how to get support for people outside the age group of the garden. For example, I think a 22-year-old son lost his father, and a 22-month-old was the youngest. And they wish that they had known of some resources at that point, and maybe even now. Are there any resources that you can mention?
Well, I'm available to consult with anybody about any age person. So you can absolutely give me a call. I'll put that in the chat. And we can go from there. It's 727-5749, area code 413. So that's on there for everybody. And I like I did with trying to do with the call here, I like to kind of get a sense of, the individual situation. And I can't, it's really hard to just give out, one particular resource. So I will, ask some questions, what the concerns are, what their questions are, and then try to, go from there, brainstorming what might work best for that, in that situation for that age person.
That's great to know that you're out there, Shelley, and that you can be a resource. So yeah, I'll suggest that they reach out to you, and you can brainstorm. One thing that I'd like to just say a couple things about what's available at NAP. I think that often parents will be trying to help their children and not knowing where to turn to. And I think it's really important that people understand that your pediatrician is there to help, and that there are different phases of difficulties, as you had mentioned, and that you in your talk about the acute phase of difficulty sleeping and eating and not getting to school, and then there's a longer term process that may be difficult, that more complicated grief. And in any of those circumstances, if you're having difficulties as a parent trying to decide how to deal with this, if this is something that's just typical or not typical, please give us a call. Give your pediatrician a call. They can give you some resources. They can also give you some guidance. They can give you some help in the immediate phase of helping children who are panicking, who can't sleep. There may be acute types of therapy that we can offer, as well as short-term medication. Not that that's my first go-to, but there are things that medication can do for short-term, or if it turns into a long-term difficulty. We have five behavioral health clinicians who can give some support as well. So please don't hesitate to give your pediatrician a call. And if we can't help you, we can at least point you in the right direction. That direction usually is Shelly, but not that you may always remember the numbers. We're there, and we will help you with that. Any last minute questions or anything else that anybody would like to say? Or Shelley, any last minute things that you would like to comment on?
I don't think so. Yeah, I mean, it's been a real pleasure and honor to work with you all these years, Dr. Schwab, and to, be asked to give this talk tonight was, great. And I, look forward to any questions that may come up or out of it. Just give a call. Don't hesitate.
I will. And there's no substitute for the garden. I don't know of any other place nearby for our patients and families. So it's a valuable resource, incredible. So keep doing that great work. Thanks so much for joining us. I appreciate it.
You're so welcome. Good night, everybody.
Be in touch. Bye-bye.